Enjoy Clean Ghana campaign, the Accra Metropolitan Assembly has commenced the assessment of public toilet facilities with a star rating system. The facilities are expected to be rated as is done for hotels, with ratings from 1 star to a 4-star rating system in accordance with the Assembly's health and sanitation regulations. The head of AMA Sanitation Team, Florence Kuchi, says the rating system will be an eye-opener for public toilet operators to maintain proper sanitary conditions. There's more in this report.
Last month, the AMA trained about 150 public toilet operators. The training was aimed to educate, public toilet operators in a way to maintain cleanliness in their various washrooms. So today we are here at the Abubleshi bus station terminal to check whether they are actually complying with the AMA health regulations. About the star rating, and that was supposed to start 1st July, but we are now beginning the assessment. So what should we expect for today?
Okay, so when cities are growing, we are now going smart city. And when we are going smart cities, everything of ours must go smart. Public toilet is one of the main drivers of a smart city. You can't have a smart city without a public toilet, because public toilet improve the city economy. It improves the health of the city. It also improves the health of the public and also bring insecurity. So because of that, we don't want the public toilet that are now springing up within the smart city to be public toilet that will be contaminated, that when somebody visits it and you come out, you are coming out with some form of bacteria or microorganisms on your hands that can lead to ailment. Today, we are now coming up to start with the star rating. So with the star rating, there's a checklist that we are going to fill. So when we are done with the checklist, if you score below 50, it means you have failed. We will have to look at what to do. Either we close down or we take action against you. If you fall between 50 to 59, we will give you yellow label. Up to 80 and above is green. If you get 80 and above, it means you are a city model public toilet, which will emulate within the city.
Here at the Abubleshi bus terminal, as you all know, the AMA started this star rating assessment last month, and they scheduled to, start implementing this whole assessment this month. So after all these checks, the AMA will rate and determine the fate of this public toilet, whether it will be shut down or not shut down. So currently, you can see the AMA officials assessing the washrooms and also all the chambers here to find out whether, in fact, this place is actually clean and also safe.
Flashes are not leaking or nasty. Or flashes, so we can check ourselves whether there's leakage. If there's no leakage, then we take. So cleaning equipment is stored and kept properly separate. Yes. So it was separate. Now on mop no niyama wa hefa. And this was separate. So you take. So we light in the end so we will not take.
Oh, yes, sir.
What's the light? It shouldn't be like this. I was saying that fita. What I say, when she asked it, we shouldn't be. Most of dispenser way. Inti I was saying we no.
That you.
I was saying we wouldn't be. Because when you contamination, so and yes, answer a dear it shouldn't be like this.
We just want to understand. So after all these checks, do you give them some days or some time for them to rectify all these mistakes?
Or depending on what you score, we will give you. So when you see here, we have yellow, amber, light green and green. So if you score below 40, below 50, it means you failed. So we'll give you a red star. There will be no star. It means you don't have a star. If you don't have a star, it means you have failed the test. the toilet will be closed down. There are some that may have some of the basic needs, but they don't have all. So when we calculate and you get 50 to 59, we will give you yellow. That is 1 star. We will paste it on you. Then we'll give you a certificate and ask you to do better.
So as you can see, they are just wiping through the edges of the door to pick up dirt and other possible bacteria that are attached to that door handle. There's no handle door there, but that's where users touch to open this particular chamber. So after swiping that edge of it, they insert it in the device. As you can see, it has only 15 seconds countdown to give the results. So after the results is released, above 80, that's 80, it means that particular portion of that door or the door in itself, it's actually unclean and needs to be checked. As you can see, this is 551, which means it's highly contaminated.
We did a checklist, that is the manual checklist, and we did a smart inspection, and then we did the ATP, that is the hygiene contamination level checks. So when we were done, he scored 69, which is 2 star. They would have scored 3 star, but the ATP brought them down. So it means they need to work much on the touches, where people comes in and touch. It means they don't clean the doorknobs, the flashing areas, and then the taps here. So they need to put much importance on those things, because that is where we can easily pick microorganisms from.
Users, those who come in every day, shouldn't they worry because of these high ratings? The ATP, shouldn't they worry?
Oh no, so they set up this business to take care of the community when it comes to their, sanitation or hygiene needs. So they have to be in the right condition so that when they come in, they know they are safe. We are doing this, like I keep saying, as a continuous improvement measure. They will not be worried. It will rather put the operator and the cleaners on their toes, and it also gives some comfort to the user. So it's a win-win situation. When they know that they are now 2 star and the next time they are getting 3 star, they even have the opportunity to, if they have to increase some of the fixtures or things around to get them good revenues, it will be done, you understand? So this is good in all ways, both for the user and then the toilet operator. Yes.
So after going through, this is where we draw the curtains. We saw that there were other assessments and other checklists that the public toilet facility was actually scrutinized through, and we realized that per their checks, they found a high level of contamination. That is the touching point. This exercise, she says that it will continue for the next 6 months. So they'll be coming here every 6 months to make sure that indeed they are obeying these rules and regulation. For Joy News, Prince Osu Ansah.
Now, reducing stigma and ensuring access to quality mental health care in Ghana is yet to be achieved despite enormous efforts made in the sector. Non-governmental organizations which have attempted to complement governmental efforts get overly stretched due to immense need for human and financial resources. Now, citizens are demanding immediate governmental intervention for holistic care for the mentally challenged who are spread across cities and communities. Hannah Odami has been exploring the case of mental health care in this feature.
Sometimes I feel very bad because some are very young and some are very old too, and some too, they are not clothing well, so sometimes you feel bad about it.
It is not only about how they feel, but the pain they can also inflict on anyone they come by.
In August 2022, a mentally challenged woman hit a man with stones at this particular spot. For those who stay and live around, it was a moment of reawakening. For how long are they going to tolerate or look over their shoulders when they see a mentally challenged person in their vicinity?
That torturous incident lingers on the minds of many who heard it, but most especially on the minds of those who witnessed that horrific act. The thought of being attacked, abused, or beaten by a mentally challenged person is an act no one would want to experience.
It's quite frustrating of late. I do meet them. Sometimes they come towards you whilst you are working, and you are a little scared, especially during the nights, and you feel you should run away. And when you try to, they try to follow you. It is something which is really, uncomfortable. And I feel the government should, in a way, try to put them together in one place. Some are very threats to life.
That intervention to get them off the streets was announced on March 2022 by the then medical director of the Accra Psychiatric Hospital, Dr. Pinaman Apau. She revealed the redevelopment of the facility into a 220-bed hospital was under government's Agenda 111 program and was part of many other projects, including the construction of 101 district hospitals, 6 regional hospitals, and 2 psychiatric hospitals.
The first date that was communicated to management was the end of June 2022. However, updates that I got recently from the coordinator of the Agenda 111 project indicates that currently they are doing what we call technical evaluation on tenders that had been submitted.
But almost a year on, not much has happened in terms of a pull down and a facelift. One would think the facility hosting some of the mentally challenged persons in the national capital will be rid of their presence around their premises. But that's not what we see here at the Accra Psychiatric Hospital. With some of them reserving permanent habitations around this place, passers-by and residents are uncomfortable.
We feel very bad because it is not good for somebody to carry a stone and throw another person. Even the person is not a madman or the person is not a mad woman. You understand? We call it a little violence. It's something that is not good at all.
Former director of the Accra Psychiatric Hospital, Dr. Akwesi Osei, delving on this development.
As at the time the idea came to pull down the structures and build new ones, we had got to the point where it didn't seem fitting for a facility of our age in Ghana. So the idea was to pull it down and rebuild it. All things were more or less in place, but somehow it's stalled. I'm sure it's not totally dead. I'm sure the plans are still there, that somewhere along the line, you'll get the funding to continue the program. That was it. Now, you mentioned 2 new psychiatric hospitals. Yes, one in the northern belt, one in the middle belt. As far as I know, they are still on the drawing board. Land has been secured, and they started building them. So we hope that funds will continue to be available for them to finish building them.
And that's all in our package for you today. There's more news on myjoyonline.com. My name is Samuel Kojo Brace.